Well, you know, King Charles of England recently underwent a procedure to treat an enlarged prostate, scientifically known as BPH, or the benign prostatic hyperplasia. And today we're on your side with Dr. Thomas Holley with the Urology Centers of Alabama to learn more about this. Thanks for joining us.
Yes, sir.
We're not going to talk about King Charles, but, you know, this is something that could be affecting some of our viewers here.
Yes,
what
sir.
is BPH?
So BPH is a very common condition that involves enlargement of the prostate gland. There are multiple types of cells in the prostate, but they all tend to enlarge and get bigger, which can eventually cause some problems with voiding and with the bladder.
So if we're suffering from something like this, what do we need to be doing?
So the first symptoms people start to experience, which can occur at almost at any age, but especially at age 30 to 40, and then as people age more, you get into the 60s, and about 60% of men are going to have it, and then at age 80, about 80% of men are going to have it. And common presenting symptoms are decreased force of stream, getting up at night, taking longer to void, those kind of symptoms. And then as those symptoms develop, as people get older, they can turn into problems where people are just doing those things too often, or it's occupying too much of their time, and so then they can come and see us and we can begin evaluation.
I need to clarify, enlarged prostate doesn't necessarily mean prostate cancer.
It doesn't. So the prostate enlargement is technically called BPH, or benign, so non-cancerous prostatic hyperplasia. So it's different than prostate cancer, and the two entities are, even though in the same organ, they're two separate processes.
Right. Is the treatment's got to be what? For BPH? For
BPH, we usually talk to men about lifestyle changes, decreasing their caffeine intake, watching their volume intake, especially before they go to bed, if getting up at night after they're asleep is a problem. And then if lifestyle modification doesn't change things, there are medicines we try, there are surgical procedures, and there's always treatments expanding for this disease process as well.
A long-term risk for this is?
So left untreated over time can cause bladder outlet obstruction, which can lead to bladder stones or permanent kidney damage over a long process of time. That's not a quick thing, but if symptoms are consistently ignored for a long time, yes, those things can develop.
Yeah, you mentioned some of the things that with caffeine intake. I assume, are there other things that we can do to possibly reduce the risk of this, or can we do anything really?
A lot of it is genetic about your prostate and how you're going to get it. And same thing with prostate cancer. Just like we warn to those families that know they have a prostate cancer risk in their family, they have to get screening earlier. Same thing with BPH. A lot of my patients will come in and say, well, my dad dealt with this. I'll be like, well, yeah, odds are you're going to have some issue too. But we tell patients, just like with almost all organs, weight loss is essential. And I was trained to tell people, heart healthy is prostate healthy as well, because even more men and women die of heart disease than any prostate problem. So it's basically heart health is prostate health.
Yeah. Urology Centers of Alabama, Dr. Holley is a part of that team. We certainly do appreciate it. Y'all do a great job over there.
Well, thank you for that.
Very much. That's who I had to deal with when I was going through my prostate cancer. So much appreciated today.